Hey, I'm Declan. Welcome to Pickering DCHC. I'm a system navigator on the gender care team. So what that means is I support folks moving towards their goals. So I usually meet with folks to kind of learn about what they need, what they're looking for, and then either support with goals directly or get folks connected with the right resources. So that could be a lot of different things, but some examples are things like helping folks get connected with different groups to hang out and connect with other trans and gender diverse folks. Support with expression stuff. So for example, we have a clothing program where folks can access clothes for free. We also have gender gear support. So supporting folks to learn more about binders and tucking underwear and padding and packers and all that stuff, as well as supporting folks to access those things if they don't have them. Gender can be connected to so many different aspects of our life. Could also be support with legal name and gender marker changes if folks are looking for that. Support for families and loved ones, as well as different referrals for other services. So folks are looking for voice training or hair removal stuff, but also things mental health resources or housing, food security, or income support resources. Yeah, lots of getting folks connected with the right people, and also lots of support navigating the healthcare system as well.
Clients will come to us who identify as transgender, gender expansive, non-binary, and who are oftentimes interested in starting hormone therapy, feminizing or masculinizing hormone therapy. So we meet with them, we establish their goals, what it is that they're looking for. We do an assessment of them, and then provide blood work monitoring, and do some focused physical exams as well to determine that it's safe to start a medication. And then we would prescribe that medication, monitor them through it, have certain intervals where we would see people, follow up with them, find out how they're tolerating the medication, do any sort of dose increases or decreases, up until the point where then we would eventually, once they're on a stable dose, transfer that care back over to their primary care provider or medical doctor or nurse practitioner in the community.
I think having a dedicated gender care youth space in the healthcare system is really important, because I think often youth struggle with feeling safe in a particular space, whether that's at a doctor's office, whether that's at school or at home sometimes. And so I think as a healthcare organization, it's really important to make youth feel safe and make them feel like they have somewhere where, one, they can be themselves, and they also don't have to be afraid of opening up and telling people what might be going on. Because I think often the big struggle and what sometimes leads to really bad or poor mental health outcomes is that youth often don't feel that they can speak up, or they don't feel like they can tell someone what's going on. And so being a trusted and safe space for youth is a really important thing to highlight. It lets them know that they can come here, and that it's safe to come here. I think that working with youth and helping support them when they're younger often leads to way better outcomes, especially in mental health, when they are an adult. So I think if you don't start that when they're young, it's going to be much harder to kind of support mental health when they're much older.
Well, it's so important, because we're taking care of, all a client's potential health issues, right? Whether that's medical, social, legal, emotional, and mental health, right? Where there's not a lot of services in Durham Region, unfortunately, that incorporate gender-affirming care and looking at every aspect of a person's health. Well, it's so important for clients to have a safe space where they feel comfortable talking about what they're going through, how they're feeling.
If folks want to access the gender care team and get connected with our services, they'll fill out a referral form. I'll sort of have a call with them to explain some more info about the gender care team and learn about what they need, what they're looking for, and then help make some appointments for the different providers based on what they need.